All right.
Okay. Hi, I'm Ella. This is my IM injection validation video. Just to start, I'm going to be reviewing the patient chart. My patient today is Joanne Peterson. Date of birth is 12/10/47. She's no allergies. She's a high fall risk. She's a full code. It says here that she is on the medical surgical unit for admitting diagnosis of dehydration and falls after being found by her son at home. She has a past medical history of hypertension and asthma. Her medications are furosemide, albuterol, and acetaminophen. She lives alone at home, has 2 children. Her son lives next door and her daughter lives 5 miles away, and she's a retired accountant. She is 145 pounds and 5'4". Looking at her handoff report and assessments here, everything looks normal. She has normal vital signs. I see here that she's a high risk for falls, that she also has soreness from falling, which makes sense. Switching over here, I'm going to look at her MAR. I'm noticing on the MAR that she has her Fluzone, which is the influenza vaccine, is due now. So just to start, I'm going to go talk to her about that real quick. So, provide privacy. Hi, my name is Ella. I'm going to be your student nurse today. Can you verify your name and date of birth for me?
Joanne Peterson, 12/10/47.
Perfect. Hi, Joanne. How are you doing today?
I'm okay. I'm a little sore from my fall.
Yeah, I'm sorry about that. So I just came in here real quick to let you know that you have your flu vaccine that I can give to you now. It looks like you haven't gotten it this year. There's unknown the last time that you got it. Are you interested in getting that today?
Yeah, sure.
Okay. So I am just gonna go get that ready for you. I'll be right back, okay?
Okay.
Leaving the patient's room. All right, so I'm gonna start by doing my first medication check with the Fluzone. So looking at the vial, we have Fluzone. This is going to be 0.5 milliliters, 0.5 milliliters. This is going to be intramuscular injection, intramuscular. It is due now. It's for my patient, Joanne Peterson, and the indication is there because she's not received her annual influenza vaccine. And also the indication is there because Fluzone is typically for elderly adults, and she is an elderly adult above the age of 65. So that's great. I'm going to start by setting up my medication then. So I'm just gonna clean my vial really quick. Cleaning it for about 15 seconds and allowing it to dry. And I'm gonna set up my blunt needle with my syringe. All right, and I'm making note here that I have the Fluzone. Fluzone, this is going to be 0.5 milliliters, so I'm going to draw 0.5 milliliters of air. And I'm going to inject that into the vial and draw up my 0.5 milliliters of solution. There we go. All right, I have my 0.5 milliliters. I'm going to safely recap this. You can see the 0.5 milliliters there. Okay, and now I'm going to put on the actual needle. Now that I've drawn up the medication, I'm going to be using a 25 gauge needle, 25 gauge needle and a 1-inch needle. I'm going to be using a 1-inch needle because this is an intramuscular injection. I need to be able to reach her muscles. And I will be giving this at a 90-degree angle for intramuscular injection. So I'm just going to start by getting this all ready. I have that already. So I'm gonna do my second patient check. I'm actually gonna label this first. I have a label right here. Oh no, if I can get this up. I have a label right here for my Fluzone 0.5 milliliters IM injection. I'm just gonna label this before I go in the patient's room, and I'm going to do my second check. So here I just drew up my Fluzone. Fluzone, I have 0.5 milliliters. It's going to be an intramuscular injection, so I know it's going to be given at 90 degrees into the muscle. It is due now. It's for my patient, Joanne Peterson, and the indication is there because she has not received her annual vaccination. So next we're going to go into the patient's room. This, knock, knock, knock. Provide for privacy. Hi, I'm back. My name is Ella. I'm gonna be your student nurse. Can you verify your name and date of birth for me, please?
Joanne Peterson, 12/10/47.
Perfect. Hi, Joanne. I have your flu vaccine right here for you. I'm gonna be giving this to you today. Real quick, do you have an allergy to eggs?
I do not.
Okay, and I see here you don't have any allergies. Is that correct?
Yes.
Okay, awesome. Have you received a flu vaccine before?
I have.
Okay, are you aware of the side effects or anything? Or would you like me to go over them?
I could use a refresher.
Okay, yeah. So basically, this vaccination is just an inactive form of the virus, the annual flu virus. And when we give this inactive form, it's going to cause your immune system to react and cause like flu-like symptoms such as like fatigue, headache, muscle aches, things like that. But really, it's just your body figuring out how to fight off the real infection if you do encounter it. So, and then another thing to know is that you probably will have some soreness in your arm. That's pretty normal too. You can just move your arm around, and that will subside in a couple days. So, I'm gonna get this all ready. What I need to do, 1 second. I can give this to you in 3 places. I can give this to you in your deltoid, which is your upper arm. I can give this to you in your ventral gluteal muscle, which is like your butt, your hip. Or I can do it in your vastus lateralis, which is your anterior thigh. Which place would you prefer today?
I'd like it in my arm.
Okay, would you like it in your left or right arm?
Left.
Okay, so I'm just gonna clean this up real good right here. Just waiting for 15 seconds and allowing it to dry. Okay. And I'm gonna do my last check here. We have my flu zone vaccine, 0.5 milliliters, 0.5 milliliters. This is the IM. I'm gonna do it in her deltoid, in her muscle. It is due now. This is my patient, Joanne Peterson, and the indication is there. So we're gonna get this all ready for my patient. All right, I'm gonna be giving this at a 90-degree angle right into your muscle. I'm gonna use the Z-track method. Injecting this. All right, I'm gonna apply pressure over that and recap this safely. And put that in the sharps container. There's no bleeding there, that's great. I can put a cotton swab if there was bleeding. Perfect. All right, Joanne, I'm just gonna hang out here in here with you for several minutes just to make sure that you don't have any adverse effects or any bad allergic reactions. So, now it's been a couple minutes. She seems to be okay. She's having no issues whatsoever. So I'm gonna make sure her bed is in the lowest position, that her call light is right here. Joanne, is there anything else, any other questions you have for me right now?
No.
And then is there anything else I could do for you right now?
No.
Okay, so then I'm gonna leave my patient's room. I'm going to document that this IM medication was given, and then I will check on her again in about 30 to 60 minutes. And yeah, that's it.